Welcome to section 15 of metabolism. In this section, we'll be discussing homocysteine metabolism. Let's get started. This is the metabolic map provided in section 1 of metabolism. In this video, we're focusing on homocysteine metabolism. The homocysteine metabolic pathway can be seen right here. Let's zoom up on the pathway. This is a detailed figure of homocysteine metabolism, which can be found in section 15 of metabolism. Notice from the figure that homocysteine can be metabolized by two separate pathways. On the right side of the figure, it's metabolized to cysteine, and on the left side of the figure, it's eventually metabolized to succinyl-CoA. This can then be used in the TCA cycle. Also notice on the bottom right side of the figure that there are several important vitamins which are necessary for the metabolism of homocysteine, and also a disorder called homocystinuria. Let's focus on the right side of the figure first. Homocysteine can be converted into cystathionine by the enzyme cystathionine synthase, which requires vitamin B6. Also notice that a deficiency of this enzyme results in homocystinuria. This results in a high level of homocysteine, which spills out in the urine, hence the name homocystinuria. Also notice from the figure that a deficiency of cystathionine synthase means that both cystathionine and cysteine are unable to form. Cysteine is normally a non-essential amino acid, but in this disorder, it becomes essential because the synthetic pathway is disrupted. This means part of the treatment should include supplementation with cysteine. This disorder can be devastating because high levels of homocysteine are toxic. As this substance accumulates in the blood, it causes intellectual disability, hypercoagulability, ocular lens displacement, and a marfanoid habitus. A cystathionine synthase deficiency is the most common cause of homocystinuria. However, it's important to know that there are several other potential causes. For example, a deficiency of methionine synthase, which you can see right here, or a deficiency of vitamin B6 could both cause metabolic impairment of homocysteine. So if you get a question about this disorder, pay close attention to which substances are elevated. For example, in a methionine synthase deficiency, you'd expect homocysteine, cystathionine, and cysteine to all be elevated. On the other hand, in a deficiency of cystathionine synthase, right here, you'd expect homocysteine, methionine, and propionyl-CoA levels to all be elevated. So you can see that the picture may vary depending on where the defect is. Okay, let's see what your text says. Homocystinuria is most commonly due to a deficiency of cystathionine synthase. This results in elevated homocysteine in the urine. In this specific type of homocystinuria, cysteine becomes an essential amino acid. Symptoms include intellectual disability, hypercoagulability, ectopia lentis, and a marfanoid habitus. Okay, let's do a question. A 4-year-old boy is brought to the physician by his mother due to swelling in his leg. His mother states that his symptoms developed yesterday. Since then, the boy has complained of difficulty walking. On exam, he is noted to be intellectually delayed. He is in the 99th percentile for height, and his limbs are especially elongated. Labs reveal elevated cystathionine and homocysteine. A deficiency of what enzyme is most likely responsible for this patient's condition? From the question stem, hopefully you gathered that this patient has homocystinuria. We can deduce this because labs reveal elevated levels of homocysteine. Additionally, the boy has a marfanoid habitus, so his limbs are especially elongated, suggestive of a marfanoid habitus. He also has intellectual disability and what appears to be a deep venous thrombosis, or swelling in his leg. These are all classic symptoms associated with homocystinuria. To get this question right, it's also critical that you notice that both homocysteine and cystathionine are elevated. Based on the labs, we can conclude that the boy must have a deficiency of methionine synthase. From the figure, we can see that a deficiency of methionine synthase would cause elevations in homocysteine, cystathionine, and cysteine. Additionally, methionine levels would be low. Because this patient has high homocysteine and cystathionine, we can conclude that methionine synthase must be deficient. As you can see, it's important to pay close attention to which substances are elevated in homocystinuria, because this should clue you in on what specific enzyme is deficient. Okay, let's continue discussing the pathway. In the figure, you can see that the conversion of homocysteine to methionine is associated with several other reactions shown above and below this particular step. This may be somewhat confusing to look at first, but the main takeaway point is that both folate and vitamin B12 are required in order for this reaction to occur. If we look at the reactions occurring above methionine synthase, we can see that folate is a necessary vitamin for the synthesis of tetrahydrofolate. So it's a little bit covered up by my red circle, but tetrahydrofolate is right here. Tetrahydrofolate is converted into 5,10-methylene tetrahydrofolate right here, which is then converted into 5-methyl tetrahydrofolate by the enzyme methylene tetrahydrofolate reductase, or MTHFR. If any of these reactions are disrupted, then 5-methyl tetrahydrofolate is unable to be synthesized, which prevents the conversion of homocysteine to methionine. And as I already showed, notice from the figure that the enzyme methionine synthase requires vitamin B12. So the main takeaway point is that the conversion of homocysteine to methionine requires both vitamin B12 and folate. Once methionine is generated, it can be converted to S-adenosylmethionine, or SAM, S-adenosyl homocysteine, and then back into homocysteine. This cyclical process is important because it generates SAM, which is involved in methylation reactions. Conversely, methionine can be combined with pyrimidines and lipids to form propionyl-CoA. This can then be converted into methylmalonyl-CoA and then succinyl-CoA, which can be used in the TCA cycle. Notice that the conversion of methylmalonyl-CoA to succinyl-CoA is catalyzed by the enzyme methylmalonyl-CoA mutase, and that this requires vitamin B12. This brings up an important point. Homocysteine to methionine requires both vitamin B12 and folate, while the conversion of methylmalonyl-CoA to succinyl-CoA only requires vitamin B12. Based on this information, you should be able to deduce what labs would be elevated in a patient with a folate deficiency compared to a patient with a vitamin B12 deficiency. Okay, let's do a question. A homeless male presents to the ED with a constellation of symptoms, and the physician on call is concerned about a vitamin deficiency. Labs are ordered and reveal elevated levels of homocysteine and normal levels of methylmalonic acid. Supplementation with what vitamin would likely improve this patient's condition? Okay, so this patient has elevated homocysteine and normal methylmalonic acid levels. From the figure, we can see that folate is necessary for the conversion of homocysteine to methionine. Thus, a folate deficiency would prevent this reaction from occurring, which means homocysteine levels would be elevated. The conversion of methylmalonyl-CoA to succinyl-CoA only requires vitamin B12, and it does not require folate. This means a folate deficiency would result in elevated levels of homocysteine and normal levels of methylmalonic acid, or methylmalonyl-CoA. This is exactly what was described in the question, so we can deduce that our patient must have a folate deficiency and that supplementation with folate would improve his condition. On the other hand, notice that vitamin B12 is necessary for the conversion of homocysteine to methionine and methylmalonyl-CoA to succinyl-CoA. This means that in a vitamin B12 deficiency, the patient should have elevated levels of homocysteine and methylmalonic acid.